Hi students, this is Dr. Tatum. This is going to be my final recording for chapter 6. And so what I'd like to do is walk you through a few pertinent slides that I think is going to be most helpful as you start to learn some of the terms in regards to pregnancy. And then I'd also like to point out a few things in your textbook that I think will be beneficial as you start studying this content. So with that, I'd like to start on slide 3. And slide 3 starts with the different terms associated with pregnancy. I'd also like to draw your attention to page 170 in your textbook. And there's a box 6-1 that walks you through the different definitions related to gravidity and parity. And so please take a look at that. It's a great resource as you start to learn these terms. So the first term that I'd like to talk about is gravida. Gravida is a woman who is pregnant. Gravidity is a pregnancy. And a multigravida is a woman who has had 2 or more pregnancies. A multipara is a woman who has completed 2 or more pregnancies to the stage of fetal viability. So viability just means that the fetus is able to live outside the uterus, and usually this takes place at around 22 to 24 weeks gestation. Now, remember, we have so many advanced technologies in place that if a fetus was to be born early, so at 22 to 24 weeks, we could intervene and basically help sustain life for that new baby. Usually, fetal viability also has to be at least 500 grams. So if we weigh the patient, the fetus has to be at least 500 grams. A nulla gravida is a woman who has never been pregnant. A nullipara is a woman who has not completed a pregnancy with a fetus or fetuses who have reached the stage of fetal viability. And parity is the number of pregnancies in which the fetus or fetuses have reached viability, not the number of fetuses born. And so you're going to see parity more when we use the 2-point system. And so the 2-point system is gravidity and also parity. So we just use gravidity and parity as we calculate the number of pregnancies she has had and the number of pregnancies in which the fetus or fetuses have reached viability. And then last but not least on this slide would be post-term or post-dates. So this just means that a pregnancy has gone beyond 42 weeks gestation. Nowadays, a lot of times the doctors will not allow this to happen just because of different complications that can occur. Some complications that come to mind would be like a meconium aspiration syndrome in the baby. It could also mean that the baby is too large, and that might actually increase the chances of mom having a C-section. It could be a traumatic delivery with forceps or a vacuum. We worry about shoulder dystocia. And then also we worry about the effects of an aging placenta. So the placenta stops functioning the way it normally would as it gets older and older. So decreased oxygenation to the fetus with post-term or post-date pregnancy. All right, a preterm pregnancy is basically a pregnancy that has reached 20 weeks of gestation, but is delivered before the completion of 37 weeks gestation. A prima gravida is a woman pregnant for the very first time. And a primipara is a woman who has completed 1 pregnancy with a fetus or fetuses who have reached the stage of fetal viability. A term pregnancy is a pregnancy from the beginning of week 38 of gestation to the end of week 42 of gestation, so 38 to 42 weeks. And then viability is the capacity to live outside the uterus, like we talked about. So about 22 to 24 weeks gestation or fetal weight greater than 500 grams. All right, so this slide just represents the 5-point system. So if we think about these terms, the 5-point system means that G stands for gravida, so how many pregnancies, including the current pregnancy the pregnant woman has had. T stands for term, so how many term deliveries. So again, term is 38 weeks gestation to 42 weeks gestation. P stands for preterm, so how many preterm deliveries. So again, delivered anywhere from 20 weeks gestation to prior to the end of 37 weeks gestation. A stands for abortions, meaning spontaneous and induced abortions. So that could be miscarriages as well. And then L stands for living. So how many children currently are living? There's also the 2-point system that I talked about. So gravidity is the G, so how many pregnancies the woman has had, including the present pregnancy. And then parity is the number of pregnancies that have reached 20 or more weeks gestation. So there is a helpful quiz that I embedded in here. This just helps you understand the 5-point and the 2-point system a little bit more. You can take this quiz if you want to. I just found it on a website. So just open this hyperlink and it should help you with some NCLEX style questions. All right, we're going to move on. One thing I wanted to point out to you was the HCG levels. As I said before, as we started talking about our antepartum case study, our HCG levels often peak at around 60 to 70 days after conception. And HCG levels really contribute to the amount of nausea that the patient might experience, especially in that first trimester. But this is the earliest biochemical marker that helps us determine if a patient is in fact pregnant. And so you can see that it can be detected as early as 7 to 10 days after conception. And most of the over-the-counter pregnancy tests will actually test for HCG levels in the urine. And so one of the most common pregnancy tests would be the enzyme-linked immunosorbent assay test, also known as the ELISA test. Very popular in over-the-counter home pregnancy tests. So basically the woman will void on the pregnancy strip. And basically, she'll wait a couple minutes and it will tell us if she is pregnant or, in fact, not pregnant. But what it does is it reads the amount of HCG level in her urine. And so, what we tell her is to always read the manufacturer's directions because every pregnancy test is a little bit different. So, read the manufacturer's directions first. And the best time to test HCG levels in the urine is with the first morning void. So have her test right away in the morning because that's when the urine is most concentrated. Now, if she takes the test early, if she's expecting that she is going to be pregnant or she's trying to get pregnant, if she takes the test too early and it says that it's negative originally, have her wait a week and retest again. And sometimes just by waiting a week later, there's going to be higher amounts of HCG in the urine. All right. So, with that, I like to shift our attention now to our book. And so, if you look on page 172 of your textbook, I wanted to go through a chart with you that talks about the signs of pregnancy. So, with that, table 6-2 on page 172 goes through presumptive signs, probable signs, and positive signs. When you are reading this, I definitely want you to highlight this. I do want you to know these different signs. And if you see a test question on this, it might ask you, is a Goodell sign a probable sign of pregnancy? Or is it a positive sign of pregnancy? So definitely make note of this chart. I think it is very helpful in determining the signs of pregnancy. So let's look at presumptive signs together. You can see that there are lots of presumptive signs. So the patient might complain of breast changes, maybe breast tenderness or fullness. Amenorrhea, meaning that she stopped having her menstrual cycles. Nausea and vomiting, urinary frequency, fatigue, as well as quickening. So quickening, it usually occurs right around 16 weeks of gestation, but it does vary with every pregnancy. And that just means that she feels more fluttering movements. She might feel the baby move, and that is called quickening. So all of those are presumptive signs. Probable signs of pregnancy would be the Goodell sign. So again, the Goodell sign is really that softening of the cervical tip. the Chadwick sign, and we learned that the Chadwick sign is when the cervix turns more violet and blue because of increased blood flow. The Hager sign is softening of the lower uterine segment while the cervix still remains firm. And then also positive pregnancy tests. So HCG levels are detected in the blood as well as the urine. Braxton Hicks contractions can be a probable sign. And ballottement is something that you are going to read about in your chapter. I'm not going to explain that to you right now, but basically it's when the fetus is unengaged in the pelvis. And then as we work our way down, the positive signs. See, these are all the positive signs, meaning that pregnancy is definitely confirmed. Usually by ultrasound, we can actually visualize what is occurring. We can visualize the growth of the fetus. We can hear fetal heart tones, so we can pick them up with a Doppler or through ultrasound. We could definitely feel fetal movements, especially as the baby gets bigger in the uterus in that third trimester. The practitioner as well as the patient actually feels the baby move. And then the fetal movements are also visible. So those are all positive signs of pregnancy. The presumptive signs and the probable signs could be other causes. So it could occur with pregnancy, but it also could occur with other different disease processes in the body. So that's why we really look at all the positive signs. And as a patient meets with their doctor right away, usually around 10 to 12 weeks gestation, they'll do an ultrasound so they can actually visualize the fetus. And in that case, we know that we actually have a positive sign of pregnancy. All right, so that concludes my recording. Please let me know if you guys have any questions. Bring them to our Zoom meeting on Wednesday, and we can talk about any questions you might have as you go through this chapter. All right, thanks a lot. Thank you for bearing with me.